Hello and welcome to my YouTube channel. My name is Osaze Ojo. I'm a consultant physician and rheumatologist, and today I'll be discussing something that I consider very interesting, and it's titled Vitamins as Vital a Means, or you could also tag this video as Did You Know? Because there's some comments that I'm going to make, some information I'll be coming across to you, and like, I didn't know that. Well, that's essentially why this video is important, and so I enjoin you to listen to the end and enjoy. Now, when we hear the word vitamins or vitamins, what we may not realize is that it's a compound of two words, vital and a means. So when you bring the two together, it becomes vitamins or vitamins, okay? So what comes to mind is the fact that these micronutrients are vital for healthy living in our diet, and so it's important that they are in the proportion for which they are needed in the body. Otherwise, we become predisposed to having certain forms of diseases. Now, as important as these vitamins are, or vitamins, what people don't seem to realize is the fact that perhaps because they're just called supplements or vitamins, then you could actually take as much as you want without any consequence. But that's not exactly true. Now, people realize that if these vitamins are in less or in deficient states, in other words, we have less than we need, diseases could occur. What people don't seem to realize is that when you have them in excess, some of them can actually predispose to certain disorders. And so I'll be going through a number of these today, and I hope today will be an eye-opening event for you. Now, I need to make mention that these videos are not to replace your seeing your doctor. They are not intended for consultation, and so use them simply as information tools rather than making your own diagnosis and treating yourself. I hope that's well taken. Now, we're going to start with the first one, which is vitamin A. Now, what people don't realize is that vitamin A can actually be used to treat a certain form of cancer called acute promyelocytic leukemia. That's a type of bone cancer, and so vitamin A can be used to treat a certain type of cancer. Also, did you know that vitamin A can also be used in the treatment of measles? That's another did you know moment. Now, what people don't realize is that excess of vitamin A can cause arthralgia, which simply means joint pains. Arthralgia means joint pains. Now, I've made a video making a distinction between arthralgia, arthritis, and rheumatism. I'd enjoin you to look out for that video and watch. Also, excess vitamin A can cause a condition referred to as idiopathic intracranial hypertension. I'll break that down. Now, when we say in medicine something is idiopathic, what that means is that we don't know the cause. When we say something is intracranial, it means within the skull, that's around the brain, okay? And then when we say hypertension, it means hyper means something that is raised, something that is high, and tension means pressure. So in simple terms, what idiopathic intracranial hypertension means is that excess vitamin A is one of the known causes of raised pressure within or around the brain. And that's really very important. And so these patients can present with vision changes and headaches. Also, people may not know, and did you know, that excess vitamin A can be teratogenic. What does that mean? What that means is that teratogenic substances are substances that tend to harm or cause fetal abnormalities or abnormalities in an unborn child. And so patients that are pregnant need to be mindful about excess vitamin A. They can cause abnormalities such as cleft palate, which is an opening in the roof of the mouth, okay? Also, it can predispose patients to having babies with cardiac abnormalities, that's heart abnormalities. So excess vitamin A is teratogenic in pregnant women because they can cause, number one, cleft palate, number two, heart abnormalities in the unborn child. Now we move on to the other vitamins. Vitamin B1, also referred to as thiamine. Now, deficiency of vitamin B1 can predispose patients to having, number one, peripheral nerve problems such as peripheral neuropathy, what is referred to as dry beriberi, in which patients have numbness or pain, as well as high output cardiac failure, in which they have a heart failure referred to as wet beriberi. So we need to realize that a deficiency of vitamin B1 can affect the heart and the nerves. B2, that's vitamin B2, is referred to as riboflavin. Now, deficiency of riboflavin can cause what is referred to as cheilosis, where there is cracking or fissuring or ulcer at the edges of the mouth. Vitamin B3 is also referred to as niacin. Deficiency of niacin can result in what is referred to as 3Ds or sometimes 4Ds. Now the Ds are 1, diarrhea, number 2, dermatitis, number 3, dementia, and then if you refer to as 4Ds, the 4th D will be death. And then you're asking, will a vitamin deficiency result in death? Absolutely. And so this is another did you know moment. Yes, a deficiency in niacin can result in death. Now, in terms of the excess, now this brings us to the issue of taking vitamins indiscriminately. An excess of vitamin B3 can result in 1, hyperglycemia. Hyperglycemia simply means excess blood glucose. Number 2, hyperuricemia, which is excess amount of uric acid in blood. And number 3, if you do have hyperuricemia, which is excess amount of uric acid, you could be predisposed to having or developing gout. Vitamin B5, also referred to as pantothenic acid. A deficiency of this can result in adrenal insufficiency. Now, just to explain what adrenal is, the adrenal gland is the gland that sits on top of the kidneys. So if you have this as the kidney, there's a gland that sits on top of the kidneys, is referred to as the adrenal gland. Now that gland is very important because of the hormones it secretes. Now, for any reason you have a deficiency of vitamin B5, it will result in a condition called adrenal insufficiency due to reduced cortisol. Cortisol is also referred to as the stress hormone. You need cortisol to be able to go about carrying out your daily activities. When you wake up in the morning and engage in the activities of the day, it's because you are able to, your adrenals have released adequate amount of cortisol for you to go about that. And so if you have a deficiency of vitamin B5 and have reduced cortisol production, you feel fatigue, tiredness, you have a low blood pressure, have a low sugar level, and you could be nauseated and could vomit. B6, also referred to as pyridoxine. Now, a deficiency of pyridoxine will result in peripheral neuropathy. Peripheral neuropathy where you have numbness and sometimes pains. Now, 2 medications I need to draw your attention to that could result in this. Patients taking anti-tuberculosis medication, particularly isoniazid, can result in pyridoxine deficiency. And so that's why when we prescribe anti-tuberculosis medication, we usually add a medication called pyridoxine, which is vitamin B6, to mitigate the side effects of isoniazid. Another medication that people take, used for as contraception, which is OCPs, oral contraceptive medications, can also predispose patients to developing vitamin B6 deficiency. Vitamin B7 is also referred to as biotin. Now, how do patients become deficient in biotin? Number 1, long-term use of antibiotics. Number 2, excessive injection of the raw egg white. If you engage in that, over time you could become deficient in vitamin B7 called biotin. And one of the manifestations of B7 is alopecia, which is hair loss. B9, vitamin B9, also referred to as folate. How do people become deficient in B9? Excessive alcohol use. And then when patients are pregnant, they could actually become deficient. And that's the reason why if you're pregnant, you observe that your doctor usually will place you on a supplement, and one of them will be folate or folic acid. What's the manifestation? When people become deficient, anemia. When you find yourself always feeling tired, one of the manifestations of anemia is tiredness. B12 is also referred to as cobalamin, and you find an excess amount of B12 in liver. So if you indulge a lot in liver, ingestion of liver, be mindful of the fact that liver is quite rich in vitamin B12, and over time you may be predisposed to having an excess of vitamin B12. Now I need to mention that the reason why people may be deficient in B12 will be excessive ingestion of alcohol, insufficient intake of, say, meats. 2, when people become deficient, they will manifest with anemia and paresthesia. Anemia I've already described, patient feels weak, and paresthesia, where you described as pins and needles, numbness, tingling sensation, burning sensation. These are manifestations of B12 deficiency. Vitamin C, also referred to as ascorbic acid. I'm sure most of us are aware that fruits do contain vitamin C. And so the deficiency of vitamin C, particularly if you stay away from fruits over a long period of time, is a condition called scurvy, where you have swollen gums, bleeding gums, and easy bruising. And so if you have a situation where when you go to brush, you almost always notice that you spit out blood, it's important to see your dentist and then evaluate you for possible vitamin D deficiency. What people don't realize, and this is another did you know moment, is the fact that vitamin C in excess can also predispose to problems. Number one, excess vitamin C can cause fatigue. It can predispose to patients having kidney stones and also iron toxicity. You're like, what about iron toxicity? What has that got to do with vitamin C? Now, the other name for vitamin C is ascorbic acid. So vitamin C is an acid. Okay. Now, if you have ulcer, please be aware that if you're taking vitamin C, you're going to predispose yourself to having an exacerbation of symptoms in peptic ulcer disease. So, basic advice, if you have peptic ulcer disease, stomach ulcer, please stay away from vitamin C. It may be problematic. Now, how does it relate to iron toxicity? Iron, when you're giving iron tablets, iron requires an acidic environment for better absorption. And so when you take vitamin C alongside iron, the vitamin C will increase the amount of absorption of the iron and so predispose you to developing iron toxicity. I hope that's clear. Vitamin D, also called calciferol. Now, this is one of the vitamins that can be produced by the body by simply being in the sun. Now, I need to say this to you, and this could be another did you know moment, in that some people may assume that because they are in the tropics, say you live in Nigeria, you can't be predisposed to a deficiency. That's not absolutely correct. A few patients that I've treated, that are Nigerians with vitamin D deficiency or insufficiency. And so please be aware that despite the fact that you live in the tropics or live in, say, Nigeria, you could actually be predisposed to developing vitamin D deficiency. And so it's important for me to mention that. Now, how does vitamin D deficiency or insufficiency manifest? In children, they could have bow legs, or referred to as rickets. And in adults, a condition called osteomalacia, where they present with bone pains and weakness. Now, vitamin D can be in excess. You can take vitamin D and it can get to the point where the vitamin D itself that you're taking is the cause of the symptoms you're having. And what are these manifestations? Number one, loss of appetite. Number two, hypercalcemia. What does that mean? Hypercalcemia means an excess amount of calcium in the body. Now, you're wondering, what's going on here? What's the relationship between taking vitamin D and now having excess of calcium in my body? Now, this is another did you know moment. Vitamin D is required for the absorption of calcium in the gut, that's in the intestine. And so if you take a lot of vitamin D, you are going to significantly increase the amount of calcium you're taking into the system. And so what happens is that with increased amount of calcium you're taking into the system, you're going to be predisposed to having kidney stones, bone pains, and other manifestations. I'm pleased to inform you about my book, Choosing the Right Career. Your Career is a Career. It's now available on Amazon, and I appreciate if you could get a copy for yourself and for your children if they're teenagers or in university. If you need to get a copy of this book, all you need to do is to use the link that I'm going to put on the description of this video. Otherwise, go to Amazon and just type in Choosing the Right Career. Your Career is a Career. And then my name is Ojo, or Osaze Ojo, and you should be able to get a copy there. Enjoy the reading, and please do leave a review online. Thank you very much. Vitamin E is referred to as tocopherol. Deficiency of vitamin E will cause muscle weakness and demyelination. I'll explain what demyelination means. Around the nerve, there is an insulating layer called the myelin sheath. What that does is that it allows electrical impulses to travel fast and efficiently along the nerve fiber. And so if you have a patient that has vitamin E deficiency, patient could present with numbness and tingling sensation. It's also important to realize that excess vitamin E can cause problems. For example, it could lead to thinning of blood. In other words, an increased risk of bleeding, and this bleeding may even occur in the brain, resulting in hemorrhagic stroke. Therefore, it's important for us to realize that the deficiency of a vitamin or the excess of a vitamin could potentially cause problems. Vitamin K exists in a number of isoforms, and one of the isoforms is referred to as phytoquinone. Now, deficiency of vitamin K will occur from prolonged use of antibiotics. It's important to mention that vitamin K is not present in breast milk, and babies that are born will need to have an injection referred to as vitamin K injection when they are born. Now, it's important to mention how vitamin K is produced. Usually this occurs from the gut bacteria, and so babies don't have enough bacteria in their gut to produce adequate amount of vitamin K, so it's important that they get intramuscular vitamin K at birth. And this is one of the things that usually will take place, in the hospital setting, but it's important that if you're pregnant, discuss it with your doctor just to make sure everything is in place. Now, the reason why it's important to have that injection is that if they don't, they're predisposed to having bleeding in the brain, referred to as neonatal hemorrhage, which can be devastating. And then finally is zinc deficiency, I should say. Now, for zinc deficiency, one of the manifestations is dysgeusia, which is metallic taste in the mouth, anosmia, which is partial or full absence or lack of ability to smell. I'm sure you remember during the COVID pandemic, one of the supplements people were taking a lot of was zinc, and also used in treatment of patients. Another manifestation of zinc deficiency is delayed wound healing, and another is male hypogonadism. And in short, to put it in short, is that infertility is one of the manifestations of zinc deficiency. And so we see very clearly that vitamins are important. However, if they're taken in excess or having them in less than the proportions they should be in our systems could result in medical conditions. If you've enjoyed this video, you've learned something, please feel free to subscribe and share before you go. Thank you and bye.